The United States launched a new global health cooperation framework with several African countries, a departure from traditional aid. Instead of donor-driven programs, the new model emphasizes bilateral agreements, shared responsibility, and domestic investment. However, it's not all smooth sailing. Kenya was one of the first countries to sign onto the framework, positioning itself as a pilot for a new era of US-Africa health relations. Now, the High Court has suspended its implementation, pending a hearing and determination of a case filed against it. The Kenyan president has been forced to defend it.
There is no equivocation of whatever that the agreement we signed can undermine the interests of the people of Kenya, including matters to do with our health data.
The Kenyan government has insisted that the agreement aligns with its push for universal health coverage, digital health records, and local workforce training. Those against the deal, however, say African governments are giving away too much, something that Professor Matthew Kavanagh, the director of Center for Global Health Policy and Politics, agrees with.
This is very dangerous, and it's really problematic for African countries to be signing away core ideas of sovereignty, like who will you share technology with? Who will you share samples of viruses with? Who will you share the health data of your citizens with?
Kenya has signed the largest deal so far, getting a $1.6 billion health cooperation framework covering the years from 2026 to 2030. Other countries that have similar deals include Ethiopia, Nigeria, Uganda, Lesotho, Rwanda, and Eswatini. But these health deals are unfolding against a complicated political backdrop. Some of the countries signing these agreements have recently faced US aid cuts, while others maintain separate arrangements with the Trump administration, including agreements to host third country deportees. US officials insist there is no formal linkage, but analysts say the timing raises questions.
The idea that that would be agreed to over a barrel, where countries are facing massive aid cuts if they don't agree to at least these basic pieces, and that within that there's the sharing of patients' information, is a little bit unheard of. And it really is about the US trying to figure out how it gets what it needs while also withdrawing from the World Health Organization.
While supporters argue that the framework empowers African governments to take ownership of their health systems, critics warn it could strain already overstretched national budgets and leave vulnerable population exposed if domestic financing falls short.
And that reduction in funding is not only going to make it more difficult to run African health systems, it's going to make it more difficult to protect the world against diseases that outbreak.
From aid to agreements, America's new health cooperation framework marks a defining shift in US-Africa relations. Whether it becomes a blueprint for sustainable health systems or a risky experiment will be seen through African hospitals, budgets, and communities. Enoxi Kolia, CGTN.